Hello, everyone. This is RFA, and welcome to Offbeat Medicine. So, let's talk about Hirschsprung's disease. It is a congenital megacolon characterized by lack of ganglion cells, enteric nervous plexus, both of them, the R batch and the Meissner's. R batch, the second name for R batch is myenteric. So myenteric plus Meissner plexus, where? In the distal colon. So again, you have a lack of myenteric and Meissner plexus in the distal segment of the colon. Why? Because of the failure of neural crest cells migration. It is associated with loss of function mutation RET. Mutation in the RET gene, or RET. So normally what's happening is the neural crest cells, they migrate caudally. So they're gonna go from here all the way towards the rectum, right? But here you have problem or failure of that migration. So we don't know where the failure is. The failure could be here, like from this moment onwards. We don't have neural crest cells. So one thing we are sure about, that is that it has to involve the rectum, because it's the failure is as I said, the NCCs, the neural crest cells, they migrate caudally. So if they cannot, that's the first hit they can hit if they're gonna migrate caudally, right? So that's the rectum. So rectum is always involved. We'll put it in simple words. The rectum is always involved. Okay. So let's talk about its presentation. It presents with bilious emesis, abdominal distension, failure to pass meconium within 48 hours. Yeah, as I said, the rectum is involved, so you cannot pass the meconium. I mean, it takes that much time to pass that meconium, right? Or you are waiting like 1 day, 2 day, you didn't still pass the meconium, right? That's 48 hours, which leads to chronic constipation. This is what I was talking about. Normal portion of the colon proximal to the A ganglion segment is dilated. Okay, yeah, this is something else. Well, in this one, it's simple. Let's say you have here, the rectum is involved. So the normal portion, which has these let's say these are the neural crest cells. Let's just say that. So they are dilated. But the part which does not have those neural crest cells is gonna be constricted, collapsed. Okay, and resulting in a transition zone. So you have a transition zone. So you have a dilation, a transition zone, a fully collapsed area. Important association, it risk increases with the Down syndrome, explosive expulsion of feces, squirt sign. When do you see the squirt sign? When you manually try to empty the rectum on digital rectal exam or digital exam. So as soon as you hit the rectum, I mean the feces are there, it's just gonna squirt sign. The whole thing is just gonna expel explosively. It is diagnosed by absence of ganglion cells on the rectal section biopsy. Okay, because as you remember, the MS, and this is the Meissner's, and this is the myenteric plexus. So you're not just taking a biopsy of mucosa, Rectal suction biopsy, meaning you're taking mucosa, submucosa. So when you look at this biopsy now, you will see absence of the ganglion cells. That's why it's diagnostic. Okay. Some more high yield points are so one thing is you got to know rectum is always on. What else does what there is another disease in which rectum is always involved. That is the UC, ulcerative colitis. Rectum is always involved in ulcerative colitis as well. Okay. And yep, that's pretty much what we have here. One more thing about this RET gene. In here, it's the loss of function mutation in RET. So what is the thing in which we would have gain of function of RET? Same thing, but it's only gain of function. Gain of function mutation in RET gene, that is your MEN2A and B. MEN2A and B. Those are also RET mutations, but gain of function. Here we have the loss of function. That's all for this one.